Here's a shocking truth that could save your cardiovascular system. Most people taking vitamin D supplements are unknowingly setting themselves up for potential arterial damage. Dr. Jo Wort recently sparked intense discussion across social media platforms when she boldly declared that consuming vitamin D supplements in isolation represents a significant health miscalculation. Her controversial stance has divided the wellness community, but the science behind her claims might surprise you. Britain's infamous lack of sunshine means that approximately 60% of the population turns to vitamin D supplementation during the darker months from September through May. The country's consistently low UV index simply doesn't provide adequate natural vitamin D synthesis for most residents. This widespread deficiency has created a booming supplement industry. But here's where it gets controversial. Are we taking these supplements completely wrong? Dr. Ward's primary concern centers around what happens when vitamin D works alone in your system. She argues that solo vitamin D consumption can trigger calcification within your arterial walls, essentially causing calcium to accumulate where it absolutely shouldn't be. Think of it like calcium deposits forming in your plumbing system, gradually restricting flow and creating dangerous blockages. But here's the part most people miss. Vitamin K2 acts as calcium's traffic controller in your body. While vitamin D efficiently raises your blood calcium levels to meet physiological demands, it doesn't dictate where that calcium ultimately lands. Vitamin K2 steps in as the director, ensuring calcium reaches your bones and teeth rather than settling into soft tissues like arteries and organs. This partnership between vitamins D and K2 represents what nutritional scientists call synergistic supplementation, where two nutrients work exponentially better together than separately. Dr. Ward strongly advocates for combination formulas that include both vitamins, arguing that this approach prevents the potential cardiovascular risks associated with isolated vitamin D supplementation. And this is the part most people miss. The timing and interaction complexities don't stop with vitamin D. Dr. Ward extends her cautionary advice to other popular supplements, particularly highlighting the often overlooked dangers of St. John's wort. This seemingly innocent herbal remedy can dramatically interfere with prescription medications, potentially rendering birth control pills ineffective and leading to unplanned pregnancies. The herb also poses serious risks for individuals taking blood-thinning medications or heart drugs like digoxin. The absorption competition between certain supplements adds another layer of complexity that most consumers never consider. Zinc and magnesium, both essential minerals, actually compete for the same absorption pathways in your digestive system. Taking them simultaneously, especially in high doses, significantly reduces their individual effectiveness. It's like trying to push two large objects through the same narrow doorway simultaneously. Neither gets through efficiently. Dr. Ward recommends strategic timing for optimal absorption. Zinc should always accompany food to prevent stomach irritation and improve uptake, while magnesium often works best when consumed in the evening due to its natural relaxing properties that can support better sleep quality. The response to Dr. Ward's advice has been notably polarized. Supporters praise her for addressing gaps in conventional medical education regarding supplements, with many noting that their own physicians dismiss supplementation as unnecessary. Critics argue that her recommendations oversimplify complex nutritional interactions and may create unnecessary anxiety about supplement safety. Healthline's research supports Dr. Ward's vitamin K2 recommendations, explaining that calcium buildup in blood vessels significantly contributes to developing serious long-term conditions, including cardiovascular disease and kidney dysfunction. This validates the importance of ensuring proper calcium trafficking throughout the body. But here's where it gets controversial. Should we be questioning the entire supplement industry's approach to single nutrient formulations? If vitamins and minerals work synergistically in whole foods, why do we accept isolated supplementation as optimal? The broader implications of Dr. Ward's message challenge consumers to become more educated about their supplement choices rather than assuming that more is automatically better. This perspective suggests that our relationship with nutritional supplementation requires the same careful consideration we'd give to prescription medications. What's your take on this supplement controversy? Do you think the wellness industry has oversimplified complex nutritional interactions? Or is Dr. Ward being overly cautious about combinations that have worked for millions? Have you experienced any unexpected effects from your current supplement routine that might support or contradict her recommendations? Share your thoughts and experiences. This discussion could help others make more informed decisions about their nutritional choices.